Hi, Peter. You have been on technical committee for ISO 1345. In the light of that, I was wondering, is read and understood okay to use for training and updated procedures?
Yeah, well, regretfully, I would say it's okay, but it's a really, really bad way of training staff. So if you look into 622 in the ISO 1345, the B clause says that the organization, and I'm not reading it by heart or remembering it exactly, but it basically says you need to train people in the organization so that they can perform their job properly. And the question then is, if you give a procedure, which are usually not that, how should I put it, motivational or engaging, there are usually aren't that many color pictures in them. It's not the best kind of training material you can come up with. So people read that, and then they're supposed to sign off that they understand, which would then be 622C in the ISO 13.5, which is about evaluating the effect of the training actions taken. And that, I can say, is a really bad way, again, of doing it. But lots of medical device companies do it. But I think also that the amount of companies doing it means that if every notified body auditor would go out and say, look, you're not allowed to use that, it's not good enough, they wouldn't have any medical device manufacturers left to audit. I mean, it's such a widespread use. And I should say, in their defense, if it's a super small change, like you clarified something in the procedure to make it better, absolutely, do read and understood. But if it's a larger change or a completely new procedure or new staff, even worse then, you don't want to give them, and I know this happens a lot. I have lots of customers where they say, yeah, I got 40 procedure that I, like day one on my new job, that I should read and then sign that I understand it. And that's horrible. And there are those that say that the number of non-conformities in an organization is directly proportionate to the number of read and understood.
So why is that commonly used then?
Well, it's to cover your back. It's super cheap, super fast, and you can tick the boxes, but it really doesn't mean anything for the quality of the products or the way people behave in the organization. So it's just a show of, to show off that we've done something, but it's really not helping.
But aren't you then practically saying that read and understood means that it's sufficient and perhaps not sufficient, but it's easy to do, but in the long run, it will be costly because you get non-conformity.
That's what I'm saying.
It's really not a good way.
And you remember, maybe there is that small joke about a CFO saying to the CEO that, should we really spend all this money on training our staff? What if they then leave? And the CEO says, what if we don't and they stay?
That's okay. All right.
Yeah. You want qualified staff, right? You want that. And there is that thing with the Dunning-Kruger curve, which means that those that are really, that are not so good at the topic, they tend to overestimate how good they are, whereas those that are really good, they underestimate it. So if you find someone that says, well, there's so much to learn about this. I've studied it for years, but there's still so much to learn. They're probably really qualified. And then there are those that say, I know this, it's super simple. They are probably on the lower end where they have no clue. And then we let them say if they understood the procedure. So it's a recipe for disaster.
So what is that quick fixes? Perhaps some intermediate step before you go to full.
Yeah, the least thing you can do is to implement, if you have your quality management system in an EQMS, is to try to work with an EQMS where there is a capability to do quizzes at the end. So once you read the procedure, at least you go through 5 or 10 well-written quiz questions that tests you on the key concepts. Then you actively need to prove that you know something. And that's something I know from our courses. People are always saying in the course evaluation, like, that was great because I thought I knew it, and then I got the quiz question and realized that I didn't understand it yet. And that's the effect you want. So they do it until they know the answer and get the right knowledge.
So, a kind of quick fix would be to add quiz questions at the end to just check
that's
people.
The absolute minimum. Yeah.
Right.
And then obviously start looking at, is reading the procedure the right mode of training? Should you invest more in it? Should it be a presentation? Should it be interactive? Should you have workshops? Should you send them to external trainings? I would love to have more people on my courses, as you can imagine, and you too, I guess. But really try to figure out, how do we get the maximum knowledge and skill and performance from this staff, and how do we prove it?
So is read and understood a great way to train on procedures?
No.
Well, I think no. Okay.
Can you do it? Yeah, you would probably get away with it, but it's a really bad way of doing it.
Yeah.